Breast cancer. Breast cancer is a heterogeneous disease that has long been known that does not behave the same in all women. It is different in a young woman in a old, or if it occurs before or after menopause, explains Ricardo Fernandez, medical director of IOB Bilbao Vizcaya, Baselga Cancer Institute. This ancient empirical knowledge has a basis whose molecular mechanisms were revealing over the last century, but in recent years has gained spectacular development that justifies much of the advances that have occurred in the progress of the disease, said the expert. The recently described genetic profiles allow cancer treatments to choose and define more accurately forecasts. In addition, the division into subgroups molecular developed this decade, whose incorporation into daily practice is very common, allows you to customize the available treatments to improve prognosis and reducing toxicities. Now select the best hormonal treatment, says Fernandez. Moreover, today known several genes involved in familial breast cancer, BRCA1 and 2, which allows selecting women at increased risk of this disease to increase preventive measures and tests for earlier diagnosis, indicates the medical director of IOB Bilbao Vizcaya. The emergence of nanotechnology applied to medical engineering has allowed the development of drugs that improve the effectiveness and decrease toxicity. Have also developed other anti-tumor drugs with a more favorable profile of toxicity and better tolerated, whose mechanism of action is directed to block the production of blood vessels feeding the tumor so that tumor cells die because they cannot feed. Breast cancer is a heterogeneous disease that has long been known that does not behave the same in all women. The division into molecular subgroups allows customization of available treatments against breast cancer, thus improving prognosis and reducing toxicities. Are known several genes involved in familial breast cancer, allowing you to select women with increased risk for this disease. Increase preventive measures, the chances of finding a cure for cancer and a more effective tests for earlier diagnosis. Support treatments to improve the defenses, anemia, reduce vomiting, strengthen bones have also undergone significant development in this decade, which facilitates the management of this disease. Some anti-tumor drugs. Not only is best known biology of the tumor cell, but also the environment in which the cell grows. Thus drugs have been developed whose mechanism of action is directed to block the production of blood vessels that nourish the tumor, angiogenesis drugs, so that tumor cells die because they cannot feed. Since these drugs are directed against specific targets, also have a different profile, more favorable toxicity and better tolerated. Another recent development is the emergence of nanotechnology applied to medical engineering. As explained by the expert, they have developed drugs have come into use this year in Europe, and from a known molecule nanoparticles and adding to it, improve an efficacy profile. Toxicity. This is a newly opened field that has enormous potential to achieve a cure of cancer. In addition, new classes of drugs are emerging, with different mechanisms of action that extend the known therapeutic drugs and weapons. Now administered orally, facilitating their administration. Finally, treatment support, improve immunity, anemia, reduce vomiting, strengthen bones have also undergone significant development in this decade, which facilitates the management of the disease, concludes Dr. Fernandez.